Good morning. Welcome and thank you for joining us for our Northern Light Health Good Health is Good Business Zoom conference. August in Maine means it's nearly time for the school year to begin. And as that thought takes hold for so many of us and our colleagues, so does the struggle to navigate the state's changing vaccination rules and regulations, the federal and state COVID-19 guidance, and the evolving risk of COVID-19 for our children's physical and mental health. How can we become more prepared? How can we help our colleagues feel more prepared? And most importantly, how can we help our children feel supported and safe? Today, our panelists will provide you with information to help you address these questions. I'm Karen Hawks, Vice President of Operations at Northern Light Beacon Health, and I'll be your moderator for the next hour. Our expert panelists today include Dr. Gilkey, who many of you already know as the frequent moderator for this Zoom conference series. Dr. Gilkey is the Senior Physician Executive for Northern Light Beacon Health, and today he will provide the COVID-19 update. Dr. Lisa Ryan, the Chief of Pediatrics at the Harry E. Davis Pediatric Center at Northern Light Mercy Hospital. Suzanne Mooreshead, a registered nurse and the Associate Vice President of Infection Prevention for Northern Light Health. And Chris McLaughlin, a licensed social worker and the Associate Vice President of Community and Pediatric Services for Northern Light Acadia Hospital. Fantastic group of professionals, and I'm very excited to have them join us for the next hour. Before we get started, I will read our legal disclosure. The coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light Health encourages everyone to follow federal and state governmental guidance and mandates. Northern Light Health does not know the particulars of your situation, so the information presented today is general in nature and is based upon Northern Light Health's own experience, which may or may not apply in your specific situation, and which may be revised as we learn more about the coronavirus. Accordingly, following any guidance Northern Light Health presents today in no way guarantees that you, your employees, and/or your customers and clients will not contract or spread the coronavirus. Now that we have that out of the way, a reminder that this hour is for you. If at any time you have a question for one of our panelists, please use the question and answer function. I'll keep track of your questions and have our speakers respond following the presentation segment. Also, I hope each of you will take a few minutes immediately following this hour to answer our 5-question survey. Your input directly affects our topics and helps guide our future conferences. So, with that said, Dr. Gilkey will get us started today by providing an update on COVID-19. Thank you for joining us, Dr. Gilkey. It's nice to see you in the presenter seat. The floor is yours.
Well, thanks, Karen, and good morning, everyone. Let's take a look at the new cases of COVID-19 in the U.S. The gray bars on this graphic represent the daily counts, and the pink line is the 7-day average. To the far right, we see the recent upturn in new cases, and it looks quite a bit like last summer. The fall and winter surge may happen again. Looking at the trend in Maine, we see a similar upturn on the next slide. So you can see infections are increasing everywhere in the U.S., including Maine. Now turning to vaccinations. After an excellent effort into April, as you can see by the top of the graphic here, we see a significant fall off in the vaccination rate across the U.S. This is a major problem as it opens the door to the virus. Let's talk about why this is a problem. As we have experienced over the last year and a half, the SARS-CoV-2 virus mutates and creates new variants. Some mutations weaken the virus and some strengthen it. Under the evolutionary principle of survival of the fittest, the stronger variants get replicated and transmitted. The current variant of concern is the Delta variant. The graphic on the left, so the colored bars, captures the progression of this variant quite well. So looking at June 5th, and the bars above that, we note that the light orange bar represents B117 alpha variant. We learned about the alpha variant when it was dominant in the United Kingdom and subsequently became dominant in the US, as you can see here by most of these bars being light orange. Also look at the dark orange bar representing B16172, which is the Delta variant, which we've been hearing about since its devastating effect in India in April and May. Now compare those bars of June 5th to July 3rd. In 1 month's time, the Delta variant has become overwhelmingly dominant in the US. So as of last week, Delta accounted for 83% of the new infections in the US and 47% in Maine. And the doubling of that seems to be in the range of 10 to 14 days. So no doubt we're approaching 100% for both today, as Delta being the dominant. When you think about the rise in new cases and the rapidity of dominance, we quickly appreciate that Delta is a cause for great concern. Let's take a minute to talk a bit more about Delta. I've included a lot of information here and highlighted some of it. The symptoms are different than the original. So loss of smell and taste are not even in the top 10 reported symptoms. The presentation is typically headaches, sore throat, runny nose, and fever. And we appreciate that that's really common viral symptoms. We no longer can rely on loss of smell and taste as a clinical marker of COVID-19. That's how much change there's occurred. So reported in the prominent medical journal, The Lancet, a Scottish study showed the Delta variant causes double the hospitalizations as the Alpha variant. So the Alpha variant, I'll remind you, was the UK variant that we first experienced. This is a marker for increased virulence. So let's take a look a little bit more detail. Alpha spreads 50% faster than the original wild type SARS-CoV-2 that itself spread like wildfire across our planet. So if you think about how quickly the original virus spread across all of the countries of the world, Alpha is 50% faster. Now we switch gears to Delta. That spreads 50% faster than Alpha. This is not an additive effect. It's an exponential spread compared to the wild type. So really get your arms around that idea of how quickly Delta spreads. So for unvaccinated people, Delta variant makes it 225% more likely to become infected. Just think about that number. It doesn't take much to see how vulnerable unvaccinated people are and how likely it is for them to get the Delta variant. Part of the high transmissibility is because Delta generates 1,000 times more viral particles per infected person compared to the wild type. And think about this, it's measured in billions of infectious viral particles per person infected. You can begin to see how difficult it will be not to get infected. A recent study from the UK supports this concern by demonstrating that children and young adults are 2.5 times more likely to become infected with Delta. So the Delta variant is much more contagious and it makes younger people sicker. The Delta variant will determine our collective actions over the coming weeks and months. And you're already seeing that this week with some of the changes. So where do we stand with having vaccinations available to our children? Next slide, please. Clinical trials have been underway for Pfizer and Moderna for months. Age 6 months to 11 years are being studied in different age cohorts. The results data are anticipated to be released between September and November, not all at once. They'll be focusing on school age first. An EUA is anticipated for early to mid-winter. The school year will be well underway by then. For the current EUAs, final approval is a top priority for the FDA. It's recognized that approval is a key driver for some parents to make decisions about themselves as well as their children. So let's talk a little bit about boosters. Boosters are not currently recommended. The manufacturers are working on developing boosters, and technically, it is not very difficult to produce boosters. The CDC is staying focused on primary vaccinations at this time. Boosters are thought to potentially enhance the immune response. As an example, people who have had COVID-19 are recommended to get the vaccination. The response is to provide much more immunological protection compared to the natural immunity acquired through being infected. So that's a little bit counterintuitive. The vaccine actually does create more of an immune response than the natural infection. Boosters may be needed if variants develop that our current vaccines don't adequately protect against. We may find that our immune protection wanes over time and a booster would be needed. Boosters are also being considered for immunocompromised individuals, whether due to disease or the medications required in their particular situation. Their immune response to the primary vaccination may be inadequate. So there's a host of reasons for boosters. They're probably in our future at some point. So here's some information and the link to the CDC information for fully vaccinated people. I just extracted some of this information that I thought was important. This site is particularly a valuable resource, so I encourage you to go look at it for yourself. A couple of highlights. Even if fully vaccinated, there are times people probably should choose to wear a mask. This would be clearly different behavior than we are seeing in public right now. For now, the CDC language is soft and encouraging rather than directive. I'm anticipating that'll change over the coming weeks. Our current vaccines protect us against severe illness and death at a 96% level. They protect us from getting infected at the 79% level. And this is very acceptable vaccination protection. You may recall the protection against the wild type was in the 88 to 95% range, depending on the vaccine, and we call that efficacy. This means vaccinated people can get breakthrough infections at that 79% level. These infections are mostly quite mild. However, it does mean vaccinated people can transmit the virus. We are still trying to understand how frequently breakthrough infections occur. So depending on who you listen to, it's a rare event. It may be more frequent than that. On the final slide, I've put together a couple of takeaways for us. It is important to keep up with the transmissibility in your community, and the link is provided here. The transmission in a community determines applicability of the CDC recommendations, which Suzanne will be speaking about in more detail regarding masking and other interventions. Clinically, all people at K-12 schools need to be masked and follow layered protection protocols. That's how we're going to keep the children safe. The school boards will determine what's required for your communities, and they will be tied into this community tracker as well. Kids 2 to 12 should wear masks in public places and when they are around people they don't live with. Other unvaccinated people should also consider this guidance. So if you think about it, that's guidance for kids 2 to 12 as they're unvaccinated, but other people who choose to be unvaccinated but are eligible for the vaccine should consider this guidance as well. Delta variant is much more contagious and virulent. Pay attention over the coming weeks for a possible surge in new cases and possible masking requirements. Vaccinated people should seriously consider their own behaviors to help unvaccinated people to avoid infection. Avoiding infection over the next year may become impossible. The bottom line in no uncertain terms is vaccinate. This is our best bet to end the pandemic. So thank you. Back to you, Karen.
Thank you so much, Dr. Gilkey. With the start of the new school year quickly approaching, there are many questions being asked about Maine's new law, which mandates vaccines effective September 1st. I'm very happy to introduce Dr. Ryan, who will provide an overview of the state law and answer any questions you may have. So Dr. Ryan, thank you so much for joining us today.
Thank you, Karen, and welcome everyone this morning. I'm glad that you could join us. As you know, as many of you hopefully know, LD 798 was passed and goes into effect September 1st this year for the academic school year. Basically, this legislation came about in terms of an effort to protect Maine's children as they enter the school year. Maine traditionally had a very high rate of childhood immunization, and over the last decade or so, our numbers decreased significantly, so that by 2019, less than 50% of Maine kindergarten students were fully vaccinated and protected for some of these infectious diseases. So the law basically looks at different ages and grade levels, and medical exemptions are still available, but what has been taken out of the exemption is the religious and philosophical exemption. And this information and this legislation was really put together by the Maine Immunization Coalition with input from the medical community, including the Maine Medical Association, the Maine chapter of the American Academy of Pediatrics, and the Maine Osteopathic Association. Next slide, please. And this law impacts institutions that had previously allowed philosophical or religious exemptions. And that includes daycares, includes public and private schools, K through 12, post-secondary schools, and some healthcare facilities like residential facilities. And as I mentioned, it does allow some medical exemptions. This form on this slide is Northern Lights exemption form. And there are other forms that you may see in your business, and you may see for your students. Basically, the law requires that each vaccine that is exempted is associated with the reason, the etiology for the exemption, and this is required on a yearly basis for all schools and for daycare settings. So there may be different forms that are out there, and I think that Karen, and there are some links on the presentation that you could find some of this information. So the question is, what vaccinations are required for school-age children? So for children entering kindergarten, they are required to have 5 DTaps, which is your diphtheria, tetanus, and acellular pertussis. If they get their 4th dose after the age of 4, they only are required to have 4 DTaps. They are also required to have 4 polio vaccinations. And if the 4th dose is given before the 4th birthday, they would require a 5th dose after their 4th birthday. They are required to have 2 measles, mumps, rubella vaccines and 1 varicella or chickenpox vaccination. For those kids that are entering 7th grade and middle school, they are also required to have an additional Tdap, which is your tetanus, diphtheria, and acellular pertussis, and 1 meningococcal vaccination. And for those children that are entering 12th grade, they are required to have their booster or second Menactra or meningococcal vaccination. And many colleges and post-secondary schools are also adding, have requirements that are necessary. They include the 2 doses of the measles, mumps, rubella, and they must be administered after the 1st birthday. And measles, mumps, rubella vaccination that is given prior to the 1st birthday is not classified as adequate for this law. That being said, some children under the age of 1, if they have an exposure, the vaccine can be administered a little bit early, but that would not count for immunity and protection for this law. And they are also required to have 1 dose of tetanus, diphtheria, if they have not had a booster within the last 10 years. And these vaccine recommendations and the guidelines of the American College of Immunization Practices are available, and that link has also been included. And if you can go back one more, Karen, sorry. So these vaccines can't all be given at one time. So there is a timeline to give these immunizations, and if someone, for example, today was saying, oh gosh, the law changes September 1st, I'm going to need to get these immunizations. There is no way that they will be done by September 1st. So there's some nuances and some timing that is associated with this, and it will take at least 8 to 9 months to get this, all of these vaccines into a child if they haven't had any of these vaccines as of today, for example. Next slide. The daycare requirements are expanded compared to the school age requirements. You'll notice if you look here that hepatitis B and hepatitis A and the PCV is Prevnar or pneumococcal vaccination. And these are required also for daycare. This essentially is the schedule of vaccines that have been required or recommended by the ACIP and the American Academy of Pediatrics. There is a little bit of flexibility in the timing of these vaccines on this schedule, but essentially by the age of 43 months, children in daycare are required to have 4 doses of DTaP, 3 doses of polio, 3 doses of hepatitis B, 3 doses of Hib, Haemophilus influenza, which is also not included on the school age, my apology, 3 doses of pneumococcal, at least 1 dose of measles, mumps, rubella, 1 dose of varicella, and 2 doses of hepatitis A. And the next slide, please. There are some medical exemptions, and the medical exemptions really include a history of anaphylaxis, which is an IgE-mediated hives, respiratory distress, known altered immunodeficiency, for example, a child that is under treatment for cancer, a severe reaction in after vaccination, such as encephalopathy, severe significant neurological changes after vaccination. Pregnancy is a contraindication, and if a child had experienced Guillain-Barré, which is a side effect that can be associated with vaccination, which causes a weakening and a paralysis. So those are the medical exemptions. There are a lot of myths about what could be a contraindication, and these include things like a family member or a family history of an allergic reaction to a vaccination, egg allergy, severe vomiting or headache after an immunization. And these are all provided by, and I believe that Karen had attached the link, and these are all in a document from the CDC nationally, which lists both the medical exemptions and also the sort of myths, if you will, about what an exemption, what would be eligible for an exemption. What happens is, sorry, you can head back one more. So the professional judgment, so basically, essentially, like I had mentioned before, this is a copy of, on the slide, you'll see the Northern Light exemption form. So what is required is that the form needs to be completed by either a physician, an MD or a DO, a nurse practitioner, or a physician assistant. And that needs to be completed and submitted to the school. And there also is a form for daycares. And this needs to be done on an annual basis. And then those links right there are the Maine AAP form, and that form has been vetted by the Maine chapter of the American Academy of Pediatrics, the Maine Osteopathic Association, and the Maine Medical Association. And as I mentioned previously, there are different forms that you may see out there. Next slide, please. A student that has an IEP or an individualized educational plan in place as of September 1st, 21, who has elected for a philosophical or religious exemption in the past may continue to attend school without receiving these immunizations. What is required for that is that the parent or the guardian must provide a statement from a licensed physician, nurse practitioner, or physician assistant that they have consulted with the family regarding the risks and benefits of those immunizations. And that also needs to be done on a yearly basis. And you may ask, why would this exemption be in place? And children who have an IEP are children that have some special needs and educational requirements. And the law did not want to jeopardize the educational opportunity and the importance of the services that these children receive in the academic school setting. So that is why this exemption will remain in place for those children who are receiving specialized services in the educational setting. And if the student is 18 years of age or older, they also still would need to have yearly consultation with a healthcare provider to discuss the risks and benefits of these immunizations. Next slide, please. Oh, I think that's all for me. Thanks, everyone, and I look forward to your questions. Thank you.
Thank you so much, Dr. Ryan. And Dr. Ryan referenced a few links, and Andy was kind enough to put in the chat a link to the resource page where we will be posting those resources that were referenced. So please visit that if you'd like. We invite you to do so. We'll also just want to make sure you know we will be answering questions at the end of the presentations today. So keep the questions coming, but know that they won't be ignored. We will have our presenters answer them. So with that said, now I'd like to welcome back Suzanne Mooreshead. Suzanne is a recurring guest who does an exceptional job keeping us informed of the changing CDC guidelines and recommendations. So Suzanne, thank you so much for joining us.
Thank you. Good morning. It's really nice to be back. Actually, it was almost exactly a year ago when I last provided some thoughts and guidance for schools. And quite honestly, at that point in time, I really did think we would be in a completely different place this year than where we're actually finding ourselves. However, the good news is much of what we've learned and practiced during the last 12 months are really the same things that are going to keep us safe again. They are social distancing, keeping that 3 or 6 feet apart, depending if you're within the school or outside in the community. Hand hygiene, which I cannot stress enough. The key is to make sure that you have hand sanitizer readily available and make sure that all of your kids and staff are using it. Frequent hand washing and hand sanitizing will not only protect you from COVID, but it's also going to protect you from a lot of other germs and illnesses as well. And then screening, masking, as Dr. Gilkey mentioned, I'd be talking a little bit about, and some enhanced cleaning. And so we'll talk a little bit more about these last three. So screening, really, what's new? I think we probably all, are used to the questions, do you have symptoms? Well, as before, daily you should be monitoring or having parents monitor their children for all of the signs and symptoms. Even though some of the symptoms, as Dr. Gilkey referenced, aren't quite as common in the Delta variant, we're still seeing all of the different varieties of variants in Maine. So you should be asking about all of them. So again, they're cough, fever, sore throat, congestion, loss of taste or smell, and then all of the GI symptoms, nausea, vomiting, and diarrhea. They also include some of the softer symptoms, those like headache, fatigue, body aches, and pains. And it's actually those nondescript symptoms that really can be just as significant. And don't trust casual explanations from people saying it's just allergies or they ate something that disagreed with them. Even within our own staff, we have unfortunately found that it's in those soft symptoms that people have kind of written off. Those were the first signs of COVID, and then we're backtracking, looking for exposure. So really pay attention to those softer signs. The other thing you should be doing is asking, are there other illnesses within the home? Particularly with this new Delta variant that spreads so rapidly, if one member of a household has it, it's likely that the other members in the home will get it as well. So moving to masking, there's been a lot of news lately. First, the CDC has provided new guidance. This is the Maine CDC about a week ago, and they're now recommending that in all areas with substantial or high community levels of transmission, that you start masking inside. And they've also recommended that in those areas, actually within any area of the state, they're recommending that teachers, staff, and students in K-12, K through 12 mask as well. So definitely, be prepared to start the school year with masking in the classroom again, and be prepared to wear it outside of the classroom when you're inside some buildings. Now, if you want to move to the next slide, the overwhelming evidence is masking does help to reduce the spread of COVID, and wearing a mask certainly protects everybody around you. It's now recommended that everybody wear a mask indoor, regardless of the vaccination status, as I mentioned, if you're in a county with substantial or high transmission. Outside, people can still safely unmask in these outdoor settings, although those that are unvaccinated should still keep that social distancing. Now, masking in the schools, much of what you're going to do is going to be directed by the Board of Education or your school district. The one thing this year, it's easy to determine the risk in your community. As Dr. Gilkey mentioned, there was a website that that's actually in this series web deck a couple of times, which is the CDC COVID data tracking site. It is one that I highly recommend. When you go to that site, click on your county. It'll have a map of the United States as shown in the slide. And then you just click on the county where you reside or you work, and it will tell you what the risk is. It's a very simple color coding. It's definitely much easier to be able to keep track of that. So if masking is determined to be necessary, the real key points in how to make the most of your masking and to make sure that it is the most safe is making sure that the fit is, and the fit's absolutely critical. You want to make sure that you're using a mask that fits over the top of your nose and then down below your chin. And ideally, your mask that you're wearing should have a metal band right around the bridge of the nose. And what that does is that keeps the mask nice and secure around the nose, and it prevents any type of droplet or aerosol from escaping through that mask. And like before, gaiters, bandanas, and masks with valves just really shouldn't be used. They really don't provide a lot of efficacy. Now, to touch on to cleaning a little bit, I remember last year I would get deliveries. Actually, my Amazon deliveries I used to get quite often. We'd leave the boxes by the door, wait 3 or 4 days before we would touch it. Well, we've learned that that was probably a little bit of overkill. Really, what was more important was making sure you're cleaning and disinfecting your hands before and after handling items that have been shared through multiple people. For the most part, routine cleaning is sufficient, making sure you get all of those high touch items at least once a day. And as before, if you're unsure just what those high touch items are, particularly in a classroom, just get down to the perspective of your students and just kind of watch what they're handling and use those as how you're identifying what needs to be cleaned frequently. Now, deep cleaning, absolutely. If you're aware that anybody has been in your classroom or building after having COVID, certainly make sure that you take everything out and clean it very thoroughly. Now, the one thing to keep in mind, just not only in the school, but also for your home use, is disinfectants and cleaners are now far more readily available in the stores. They're not, though, all created equal. Some are not particularly effective in killing the SARS-CoV-2 virus. So I really recommend that you read the backs of labels. And on the back of every label is an EPA registration number. You can take that number and enter it into the EPA registration site. And what that will do is it will confirm is, at first, is it effective against COVID-19? And then also it will tell you just how long that disinfectant needs to remain wet on the surface for it to be effective. So that way you can use it to the best of its ability. So, well, I think we all hoped that we would not be talking about these same safety measures again this year. The good news is we know what to do to keep us, those around us, and our community safe. And by using these measures, we're going to get to the other side of this faster. Thank you.
Thank you, Suzanne. I don't know if you recall, but Suzanne was here about a year ago to help us prepare for the school year. And at that time, Chris McLaughlin was also a panelist. And so it's a pleasure to introduce Chris. So Chris, it's been a long year, no doubt about it. Our children continue to demonstrate tremendous resiliency, but the impact the pandemic has had on our children's mental health, I don't think that can be understated. So thank you so much for joining us, and we look forward to learning from you.
Thanks, Karen. It's my pleasure. Good morning, everyone. It's good to be with you all again. So I want to start this morning's conversation with a brief analogy. And if you've ever been in a car accident, maybe you'll be able to relate to this analogy, and perhaps we can then better understand this universal experience of the last 18 or so months. So when a car accident happens, most of us just go on autopilot. It happens so fast, but somehow our bodies and our brains, flooded by all those stress hormones, just react and they do whatever they need to do to keep us safe. Sometimes we can't even remember what happened during that accident, but we definitely know something happened. And for most of us, it takes several days before those aches and pains start to creep in. As our bodies wash themselves from the trauma of the event, all the protection that our bodies and brains gave us seeps away, and what's left, frankly, is pain. That pain can be both psychological as well as physical. And it may take even a few more days before a nightmare about that accident starts to seep into our sleep as well. For many of us, we can be triggered by that event years later when we're driving by the same intersection, or maybe we're hearing the song that was playing on the radio when the car crash happens. Our bodies and brains store trauma, and it comes out in all kinds of different ways. So now let's think about this COVID-19 pandemic, and you probably see where I'm heading with this analogy at this point. I've started to think about the last year and a half as one very long car accident. And instead of just a few seconds of our bodies and brains taking over during the accident, we've all been in this fight, flight, freeze mode for 18 months. And so for many of us, including youth, we've been in that similar state of autopilot for a long time now, just doing whatever we needed to do to survive, relying on our reflexes, relying on our gut instincts, making quick decisions just to tread water, just to get by. Now, as we're starting to see a light at the end of the tunnel, and despite this conversation, that light's still there. It's just maybe a little bit further off than we had hoped, but vaccines have definitely provided a light. With that light, though, I start to understand better why tempers are flaring and why fuses are so short. Everywhere we look, people are just on edge. What I think about that is that we're in this aftermath of this gigantic car accident. We're healing. Our bodies are starting to feel the pain of the last 18 months, and it's frustrating. But the good news is, for better or worse, we're healing finally. So with that in mind, I want to make sure that we're talking about the best ways to take care of ourselves, to heal following an accident. And I clustered these into 4 sets of R's: rehabilitation, recuperation, recovery, and rest. These are essential if we're going to get our bodies back on track after an accident. And so we should be embracing these in this really final stages of COVID place that we're all in right now. And remember, when we're working with somebody of any age that's been through a traumatic exposure or an accident of some sort, we want to be slow and steady with them. We want to be ready to offer additional support if needed. We want to work with them on practicing those skills that we may have assumed remained intact, or we may like to think that those skills are still in place, but patience and practice and being ready to go back and reteach some of the basics. I anticipate that a lot of teachers this coming fall are going to be doing a lot of line practicing hand raising, practicing going to and from the cafeteria or internet side from recess, even getting to lockers or changing classrooms, reteaching those basics and recognizing that it's been a long year and kids, just like many of us, are out of practice on some of these basics. So as a reminder, I want to make sure that we're well aware of the common reactions to COVID-19 in terms of the behavioral health implications. We all at this point know the data. We know the impacts that this pandemic has had on all of us, especially with kids of all ages. So I think it's very important as we enter the fall to review these common warning signs, these symptoms of both anxiety and depression, and keep this reference handy. You may want to tuck this in your desk or in a really accessible location so you can pull it out when there's something that just feels amiss in the students or for caregivers out there in your own kids, to be able to help identify when things are progressing to the place where you need more support, you need more help. Another reminder, and this is important, the first step on the next slide is to make sure that we are taking care of ourselves as caregivers and as educators first. And I know that concepts of self-care are starting to maybe feel cliche. I can see and hear the collective sighs and the eye rolls just as I say the word self-care out. I get it. It's become buzzy this last year, but it's been buzzy for good reason because it's essential. So to the caregivers and the educators out there, take care of yourself first. Allow yourself to feel sad. Adjust your expectations. Remember that the kids around us take their cues from you. And so if you maintain positive, calm demeanors, the kids around you are going to pick up on that and do the same. Just keep in mind, as long as your own mask is well secured and your oxygen flow, your self-care is moving, your kids are going to be just fine. Let's talk about self-care in the 2021 world. It looks much different than it ever has looked before. I like to apply the term microdosing to self-care these days. Self-care has got to be bigger than a 1 week, 2 week vacation, than just waiting for the weekend to hit or for something in the distance that you're planning for. Self-care is bigger than one trip to the spa or the hairdresser or making a nail appointment or a massage appointment. It's about microdosing. It's taking a little bit of something and applying it over a long period of time. Daily microdosing is essential for self-care because without it, we're risking ourselves, our families, our coworkers, our loved ones, and our livelihoods. So I've started to think about self-care the same way I think about some of our morning rituals, getting ready to face the day. Sunscreen or moisturizer, grabbing those car keys on the way out the door, and even putting on your deodorant. Things that have become habits are now essential parts of our morning routine. Self-care has got to become an essential part of your daily routine. And if you notice, just like you might notice if you forget those car keys, or if you forget to put that deodorant on in the morning, if you notice, there's something tangible you can do to remedy it. Remember that we're talking about resiliency. We're talking about everyday strategies that parents, caregivers, and educators can engage with kids in to enhance and foster resiliency. As you look at this list, think of this as maybe a board game or a roadmap. And many of you out there, I would guess, probably do these things every single day. You just haven't given yourself credit for them as being evidence-based strategies for fostering resiliency. So as you see this list, pat yourself on the back if you're seeing things that you recognize happening in your own classrooms or in your own households, making sure that you're focusing on self-care and good sleep hygiene and addressing these other things as well, whether it's around laughter or problem solving, daily routines, meal planning. Meal planning is a great way to keep kids feeling routine and predictable. When they see that menu on the refrigerator or on the cork board, they know what's coming, they can anticipate it, and it makes up for some of the loss that's happened over the last year and a half. We're talking about resiliency, and there's an image I want to share with you all that I think for me speaks the greatest around what resiliency looks and feels like. If we were together in a big room, I'd count to 3 and I'd have you all say out loud what these toys from our own childhoods are. So of course, these are Weeble Wobbles. And if you know anything or remember anything about Weeble Wobbles, you remember their tagline, right? Weebles wobble, but they don't fall down. This is, for me, the epitome of what resiliency looked like. It's not that firm oak tree that doesn't bend or flex in the breeze. It's a Weeble Wobble. It moves, it adjusts, it's pliable to whatever is happening in the environment around it. But at the end of that environmental pressure, at the end of that stress, they always go back to vertical. And that's really what we're talking about as we enter the fall, is how do we rediscover that vertical, and how do we keep kids as well as ourselves and our own families and loved ones on the path to staying vertical, adjusting, bobbing, ebbing and flowing, but always getting back to vertical. That's the Weeble Wobble. And I think we have a lot we can learn from these little things. So finally, I just want to highlight some resources. This slide is a description of some of our services that we offer through Healthy Life Resources, which is a department here at Northern Light Acadia Hospital. You see that we offer everything from self-guided support to support with leadership, resiliency, wellness, critical incident stress management, as well as these school-based conversations that we're having right now. So you see the contact information. If any of you are interested out there in learning more about these programs or bringing Northern Light Acadia Hospital into your organization to support you in any of these ways, please, please, please reach out. We're happy to help. Thank you so much.
Thank you, Chris. And the Weeble Wobble brings back a lot of memories. I don't think today's children probably know what a Weeble Wobble is, but I think they should be in every classroom now.
They're all over eBay. I've looked, Karen. Get out there on eBay.
Okay, good to know. Thank you. So at this time, we will transition to the question and answer portion of our conference. And again, I would like to invite the audience to submit questions using the question and answer feature. I'll invite all of our panelists to turn on their cameras and microphones at this time, and we'll go ahead and get started. I'm actually going to start with you, Dr. Ryan. There's been a couple of questions in the chat box I thought we'd address first. The first is related to the COVID-19 vaccine. Can you just clarify, is the COVID-19 vaccine part of the requirement as of September 1st?
No, it is not required as of September 1st. I think that, there is a fair amount, as Dr. Gilkey had mentioned, about hesitancy when something isn't fully FDA approved and is just under an EUA. So I think that there will be more to come on that. I know just personally in my practice, I have a fair number of my children age 12 and up who have gotten the vaccine. And there are still some that have some hesitancy. So I think, we all are supporting immunization, of course, and it's always difficult, with young children, especially infants. And I think families are really waiting for the information and the data and the support from the clinical trials. But right now it is not part of this law, and I don't anticipate it would be for this academic year.
Great, thank you. And as a follow-up question, Dr. Ryan, in terms of those children who will not be able to meet the vaccine requirement as of September 1st, both in school and in childcare, what is the grace period allowed for those families to get up to date with the vaccinations?
That's a great question. There really isn't, I think it's challenging, especially let's start with daycare. If you look at a 7-month-old child that's in daycare that doesn't have any immunizations, they're not going to be able to meet the requirement on that chart that I had showed earlier. But it opens up for the discussion of, starting to get that child vaccinated. I did not see anything specifically with catch-up time for childcare, but that's a great question, and I'm going to research that a little bit more. For the school-age children, there is a 90-day, and let me look at the exact terminology, a 90-day sort of effort within 90 days of enrollment of school that they are going to meet those requirements. And as I mentioned earlier, the dose between the 4th to 5th and the 3rd to 4th of the polio and the DTaP, the interval between those doses is 6 months. So the reality of being able to meet a 90-day requirement is not there. That being said, I think, me personally, for families that have embraced this law and are willing and ready to sort of start this vaccination process for these immunizations, I encourage families to reach out and talk to the principal, talk to their schools, talk to their healthcare provider, come up with a schedule. In essence, the school could prohibit those kids after 90 days from attending in person. So I think that may vary based on your school district and your individual school. And I think just having open, honest conversations about where you are and what the plan is really important.
Thank you. It's quite complicated, and COVID's been on top of mind for so many of us. I think that this has been off the radar screen, I think. So thank you so much, Dr. Ryan. The next question I'll toss to Suzanne. Suzanne, there's a question around the physical distancing and masking, the things that you talked about in your presentation. Those worked last year, right, when we were talking about the wild COVID-19. There's concern that they're not as effective with the Delta variant, and as parents are deciding whether they send their children to school or not, this is a concern. Can you address that? Are they as effective with the Delta variant?
Yeah, definitely masking helps with the Delta variant just as it did with the wild variants. And the same thing with social distancing. Both of those do make a tremendous difference. And we're not necessarily seeing any increase in transmission when those precautions are in place. It's just we've seen a lax in the precautions. People, over the last couple of months or so aren't quite as religious about wearing masks, and when they are, it's a lot of times below the nose. So I think it's more any difference that we're seeing now is more on how people are using and following the precautions than a difference in the variants.
Thank you, Suzanne. Dr. Gilkey, I'm going to toss the next question to you. I was reading an article headline this morning, and it was talking about the Lambda, just yet another variant that's causing some, concern. And these mutations just continue to happen. Is this now the world we live in, where there's an endless cycle of COVID-19 variants that are going to be hitting the media?
Well, that's an important question. I think the answer to the latter part is yes, we will continue seeing the variants. So every person who gets infected is an opportunity for mutations to occur with the virus. And mutations follow biological law. Those that give the virus greater survivability will continue to be propagated. So that's where we are with Delta. Now let's just talk about Lambda for a minute. Lambda actually is what's called a variant of interest. It's not at the level of acuity as Delta, which is a variant of concern. So that's CDC language to how concerned we are about it all. But Lambda is found in 29 countries around the world right now, including in the US at a very minor level. However, it is the dominant variant in Peru. Most of the cases around the world are clustered in South America. So it gives you some insight into the transmissibility of Lambda around there. And the concern is that it may be more transmissible than the wild type, and it may be more virulent, meaning making people sicker. So we have to keep a careful eye on that. Today, the real story is Delta. In the United States, Delta is dominant and it's very significant. So our best way to try to approach this is all of the cautionary measures that Suzanne talked about and getting people vaccinated. So we have to address people's concern about hesitancy, providing them lots of information and education, and really keep at it. So thanks, Karen.
Thank you, Dr. Gilkey. Chris, I'm going to ask the next question of you. There's a question from an audience member in terms of how can we, or any advice that you can share with parents on how they could convince their teen to get the vaccine?
Yeah, that's a great question. Because as we know, one of the fundamental aspects of being a teen is nobody gets to tell you what to do, right? And so, what I love about teenagers is that they also have an ability to start perspective taking. They also have the ability to start identifying as part of a community, a group of friends, a school, a sporting team, an after-school activity club, or even a neighborhood. And so, to really engage with kids, with teenagers, adolescents, around that idea that my choices are going to impact those around me. And so how do we reinforce making the kind of choices that are going to keep the maximum number of folks safe? Kids can get that. Kids can get their head around that, and kids can become advocates and start spreading that news as well. So also engaging your adolescents once they get that point, and once they become champions for that point, how do they then become a champion in their chosen community and put them to work? Kids love to have a voice.
So Karen, if I could weigh in on that
Absolutely.
as well. I would draw everybody's attention. I think vaccine hesitancy is a critical issue of our times right now, whether for teens and, taking advantage of their ability to logically process through information. I think that we've provided great resources for that. So I'll remind everyone that our May 6th session, our June 3rd, and our June 17th extensively covered various aspects of vaccine hesitancy, and you'll find it really as a treasure trove of information to actually have these, logical, intelligent conversations. Thank you.
Yeah, we've been referring people to those for several weeks, and clearly Dr. Gilkey has that memorized. So thank you, Dr. Gilkey. We do have a question, Suzanne. I'm going to ask this of you. Last year, there was a lot of facilities that were putting up dividers, plexiglass dividers. Is that still recommended?
It really depends on where you're at. In healthcare settings, there's some new OSHA guidance that does recommend it, but generally, no, it's one more item that needs to be cleaned. It hasn't provided a lot of extra safety particularly in school settings. They were very difficult to use around it. But if there's places that you are going to be exposed to a lot of other people coming and going, like maybe a reception area where you don't have as much control over whether somebody's sick or some of the screening, it may make sense in those circumstances. So it really depends on where you're at.
Great, thank you. And I can see that Dr. Gilkey's typing an answer, but I'm going to ask him to speak to that. I think we have enough time. Somebody asked if a vaccinated person who has breakthrough COVID can be a source of mutation for variant.
Unfortunately, as much as I want to say no, the answer is yes. So every time a person gets infected, whether they've been vaccinated or not, the virus replicates. So when you heard me talk about, 1,000 times more particles measured in the billions, that's applicable to whether we're vaccinated or not. And every time the virus replicates is an opportunity for mutations. The good thing is many mutations really weaken the virus and kind of like disappear, but occasionally, and unfortunately occasionally adds up to frequently, there are mutations that actually are advantageous to the virus to be spread more effectively. Those are the ones that we see named Delta, et cetera.
And Dr. Gilkey, I know you had touched upon this quickly in your presentation, but just to reiterate for those who are unclear, when are we expecting the vaccine to be available for 12-year-olds and under, or under 12, I should say?
So I think that we're going to see the data become available over the next 1 month or so. And during that time, I think there'll be plans for an EUA. We're thinking that early to mid-winter. So unfortunately, we'll be several months into the school year. Everything that Suzanne has talked about needs to be treated as gold. We have to do those things to keep our children safe. But I do think that if the vaccine is the cavalry, it's probably in this calendar year.
Okay, I'm going to close this out with one more question. It's going to be for you, Chris. I don't know, you probably won't have enough time to give it all the time you'd want, but many of us are in communities trying to get back into this mindset of we have to mask again, but it's not, the buy-in isn't there either among the peer group or the community at large. And do you have any tips for just how to navigate that from a mental health perspective?
Yeah, you're right. I won't have enough time to address that. So let me offer this instead. I work with a lot of families, and even just thinking about my own childhood, everybody's households are different. And I remember going to some family homes when I was a kid where grace was said before meals, but not necessarily in my home. And some families celebrate Christmas, others don't. Some have different customs and traditions around birthdays or other major events. So, I would encourage families to use those examples and remind kids that families are different and families have different sets of rules that they live by. And regardless of what other folks are doing, this is what our family is doing. This is the way our family has elected to be members of our community, to be members of a group. And I think if using some of those holiday examples or more common examples, I think kids of all ages will get that.
Thank you so much, Chris. So thank you all for joining us, and a special thank you to our panelists. We have included tools for you at the end of this presentation, and you can also find recordings of all of our Zoom conferences on our Northern Light Health website. I hope this hour has been a help to support you, your employees, and our communities. Just a reminder, we will be emailing you a survey right after our conference. Please take a moment to complete that. We value your input. Our next session will be on August 19th. At that time, we will continue our discussion about safety in the school environment while learning more about the current state of COVID-19 and the science behind the vaccine. We will send you the link for this session, and we encourage you to share the invitation with your friends, colleagues, and others who might benefit. By working together, we will keep Maine safe. I'm convinced of it. So thank you and have a wonderful afternoon and enjoy the remainder of your Maine summer. Take care.